Hey everyone, I am here to talk to you guys about oxytocin today. So, when you're pregnant, you might hear doctors or people mention the word oxytocin or pitocin and wonder what exactly is it and what does it really have to do with me and my pregnancy. In this video, we're going to break it down. Oxytocin is a hormone. These hormones are secreted by the pituitary gland. Secretion or the release of something is determined by the electrical activity or stimulation of nerve cells. These cells need to be excited in order for oxytocin to be released, right? So when it comes on to pregnancy and post-birth, the two main purposes of oxytocin is contraction of the womb, contractions, and lactation, making milk, to breastfeed your baby. The more oxytocin is released, the more the uterus contracts, the more it releases another hormone known as prostaglandins. Now, these work to stimulate even more oxytocin release, and that cycle kind of continues in order to stimulate labor. FYI, there are many things that stimulate the onset of labor, but this is just one of them, one very important part of it. Synthetic oxytocin is known as pitocin, and it is given to induce labor or to strengthen contractions in the event that labor has slowed down for some reason. In addition to this manufactured oxytocin, PIT, it is given after birth for your baby, after the birth of your baby, to speed up the delivery of the placenta and also to reduce post-delivery bleeding by once again causing that uterus to contract. During lactation, oxytocin helps to move milk from the ducts to the nipple so that baby can feed or you can pump. So, did you also know that oxytocin is also present in men? Many people don't know that it plays a really important role in the transport of sperm and the production of testosterone. Oxytocin is also very important in certain behaviors such as mother-infant bonding, trust, and sexual arousal. This is why it's known as the feel-good hormone. What do you need to know as someone planning to have your baby? You need to know that we need to bring on all the oxytocin possible. I want to give one disclaimer here. I get asked very often if oxytocin is used or stimulates labor, should I even be having sex since it's also stimulated or produced during intercourse? Yes. Don't worry. Sexual intercourse itself is really good and healthy for a mom that is not having any other issues, especially relating to preterm labor. During pregnancy, especially for the purpose of relaxation and bonding and the preparation of your baby, oxytocin is really important. Oxytocin is released using a positive feedback mechanism. So when your body is ready to go into labor, oxytocin is released, which eventually causes you to have contractions. The more you have these contractions, again, the more oxytocin is released, and therefore that leads to an increase in frequency and intensity of those contractions, which helps you to have your baby. Certain things help to stimulate or encourage oxytocin secretion naturally, like sexual arousal, yes, touch, or anything that triggers the excitement of certain cells. Basically, anything that helps you relax and make you feel good. These things will happen when your body is ready for labor, so don't worry. If you are tense, however, or fearful or overwhelmed and stressed while preparing for labor, it will only inhibit or reduce the release of oxytocin. So I encourage you to breathe, guys. You are totally capable of learning how to relax and learning techniques that helps oxytocin to flow so that you can have a faster and safer labor. If you have more questions about how to get this done, I want you to go ahead and visit jonahsbirth.com. We have childbirth classes starting up in October. Our next series starts in October, where you can learn so many techniques about how to relax so that during labor you're producing as much oxytocin as possible to help you have a successful and an easier birth. All this information came from me being a nurse for several years, me being a childbirth educator, and also from the website yourhormones.info, which is an education resource from the Society of Endocrinology. I hope you have a wonderful day. I can't wait to hear from you. DM me if you have any questions, but as always, before you follow any advice, make sure you check with your physician or midwife. Have a wonderful day.